When we talk about hepatitis B, we are not just discussing another infection found in a textbook or another topic that appears on the NCLEX exam. We are talking about a disease that affects millions of people around the world and has the potential to silently damage lives when it goes undetected. As future nurses, understanding hepatitis B means understanding the responsibility we carry every single day when caring for patients, educating families, and protecting communities from preventable illness. This is why learning this topic is not only about passing an exam. It's satsin paisi taiti yaki sanshin santis, isin samdeki santiyati atiyat. It is about becoming the kind of healthcare professional who can truly make a difference. Ism. Hepatitis B is a viral infection that attacks the liver. It can spread through contact with infected blood, sexual contact, contaminated needles, and from mother to baby during childbirth. One of the most dangerous things about this infection is that many individuals may not realize they are infected because symptoms can remain silent for a long period of time. Obesity and digestion. Some patients may experience fatigue, fever, loss of appetite, nausea, abdominal pain, dark urine or jaundice, while others may show no warning signs at all. That is why nurses must remain alert, observant, and educated. Your awareness could become the reason a patient receives early treatment and avoids severe complications later in life. As nurses, infection prevention begins with us. Every time we practice proper hand hygiene, use personal protective equipment correctly, follow standard precautions, and educate patients about safe practices, we are actively reducing the spread of disease. Never underestimate how powerful patient education can be. A simple conversation about prevention, vaccination, or safe healthcare practices may protect someone's future. Sometimes patients are afraid, embarrassed, or misinformed about sexually transmitted infections and blood-borne diseases. Your ability to communicate with compassion instead of judgment can completely change their willingness to seek care and follow treatment. In nursing, knowledge alone is never enough. Patients remember how you made them feel during some of the most vulnerable moments of their lives. A patient diagnosed with hepatitis B may experience fear, anxiety, stigma, or hopelessness. They need more than medication, they need reassurance, emotional support, and guidance. This is where your strength as a nurse truly matters. Compassion is just as important as clinical skill. The best nurses are not only skilled with procedures and medications. That is, they are strong enough to bring comfort during uncertainty. For NCLEX preparation, always remember the key priorities: prevention, vaccination, safety precautions, liver monitoring, patient education, and early recognition of symptoms. Questions may test your understanding of transmission routes, protective interventions, or appropriate nursing actions after exposure to infected blood. Think critically, stay calm, and focus on patient safety first. Nursing school may feel overwhelming sometimes, and there will be moments when exhaustion makes you question yourself. But every challenge is shaping you into someone capable of saving lives. The knowledge you build today becomes the confidence you carry tomorrow. One of the greatest achievements in modern healthcare is the ability to prevent disease before it destroys lives. And the hepatitis B vaccine is a powerful example of that success. As nurses, we must understand that prevention is always stronger than treatment. Every vaccine administered represents protection, safety, and hope for a healthier future. When you learn about the hepatitis B vaccine, you're learning about one of the most effective tools available to reduce the spread of a serious liver infection that can lead to chronic disease, liver failure, or even cancer. This is why vaccination education is not just a nursing responsibility. It's a kanche bi a CSM par mani pocham paninti. This key aftar in decent pol atainki sandi. It is a mission to protect lives. The hepatitis B vaccine works by helping the body develop immunity against the virus. It is typically given as a series of injections over a scheduled period of time. Like Kamisistis candidi type wafer. Many newborns receive the first dose shortly after birth because early protection is critical, especially for infants born to infected mothers. Healthcare workers, nursing students, and individuals at high risk of exposure are also strongly encouraged to receive the vaccine. But as future nurses, this is something you must take seriously because your safety matters too. Every day in clinical settings, nurses may come into contact with blood or bodily fluids, and understanding how to protect yourself is part of becoming a responsible healthcare professional. Infection control begins with awareness and discipline. The smallest mistake in healthcare can create serious consequences, which is why standard precautions are essential at all times, not just when caring for known infected patients. Proper hand hygiene, safe needle handling, disposal of sharps, wearing gloves when necessary, and using protective equipment correctly are habits that save lives. Great nurses are not careless. They remain focused even during busy shifts, stressful moments, or exhausting schedules because patient safety always comes first. Patient education is another critical part of prevention. Some patients may avoid vaccines because of fear, misinformation, or lack of understanding. This is where your communication skills become powerful. Nurses have the ability to educate without judgment and encourage patients with compassion. When patients trust you, they listen more carefully. Explaining how vaccines reduce the risk of severe illness, protect families, and prevent long-term complications can help patients make informed decisions about their health. Sometimes one honest conversation can protect an entire household from infection. For NCLEX preparation, remember the important nursing priorities connected to hepatitis B prevention. Understand vaccination schedules, post-exposure protocols, transmission-based precautions, and patient teaching strategies. Questions may ask what action should be taken after accidental needle stick exposure or which patient populations are at higher risk. As a Dutch says, ain't outy dog. Always think about safety first. NCLEX questions are designed to test not only your memory, but your judgment as a future nurse. Focus on prevention, infection control, and protecting both patients and healthcare workers. But beyond the exam, there is a deeper lesson here. Nursing is a profession built on responsibility, consistency, and trust. The habits you build while studying now will follow you into every hospital room, clinic, and patient interaction in the future. Some days will challenge your confidence, and there may be moments when the workload feels overwhelming. But discipline and preparation will carry you through difficult times. Every lecture you study, every skill you practice, and every sacrifice you make is shaping you into someone capable of protecting lives when it matters most. The nurse who understands prevention today becomes the nurse who changes lives tomorrow. Recognizing the symptoms of hepatitis B and understanding the appropriate treatment and nursing care can completely change the outcome of a patient's life. That's say. As nurses, one of the most important responsibilities we carry is the ability to notice early warning signs, respond quickly, and provide care with confidence and compassion. Hepatitis B is often called a silent infection because many patients may not experience symptoms immediately. Some individuals can live for months without realizing that the virus is slowly affecting their liver. This is why careful assessment and strong clinical awareness are essential in nursing practice. When symptoms do appear, patients may experience fatigue, weakness, fever, nausea, vomiting, loss of appetite, abdominal discomfort, joint pain, dark-colored urine, clay-colored stools, or jaundice, which causes yellowing of the skin and eyes. These signs may seem simple at first, but they can indicate serious liver involvement. As nurses, you must learn to connect symptoms with possible complications and understand the importance of timely intervention. Never ignore what a patient tells you. Sometimes a small complaint can reveal a much larger health problem underneath. Diagnosis often involves blood tests that detect the presence of hepatitis B antigens and antibodies, along with liver function studies to evaluate damage to the liver. Understanding these laboratory findings is important for NCLEX success and clinical practice. The key is nursing is not only about memorizing facts, it is about interpreting information and using critical thinking to make safe decisions. A skilled nurse looks beyond numbers and focuses on the entire patient condition. Treatment for hepatitis B depends on whether the infection is acute or chronic. Some patients with acute hepatitis B may recover with supportive care, rest, hydration, nutritional support, and careful monitoring. Chronic cases may require antiviral medications to slow the progression of liver damage and reduce complications. Nurses play a major role in monitoring medication effectiveness, assessing for side effects, and educating patients about treatment adherence. Patient teaching is critical because many individuals struggle to follow long-term treatment plans when they do not fully understand the seriousness of the disease. At the same time, emotional support is equally important. Patients diagnosed with hepatitis B may feel isolated, frightened, or ashamed because of the stigma often associated with infectious diseases. Your words can either build trust or create fear. This is why compassionate communication matters so much in healthcare. Nurses must provide education without judgment and create a safe environment where patients feel respected and supported. Healing is not only physical, emotional reassurance also plays a major role in recovery. For NCLEX preparation, focus on key nursing priorities such as monitoring liver function, preventing transmission, maintaining hydration and nutrition, reducing fatigue, educating patients about medication compliance, and recognizing signs of worsening liver disease. Questions may challenge your ability to prioritize care or identify the safest nursing intervention. Always remember that patient safety and prevention of complications come first. There will be moments in your nursing journey when the pressure feels intense. Exams, clinical responsibilities, and long hours of studying can test your confidence. But every challenge is strengthening your ability to remain calm under pressure and think critically during difficult situations. Nursing requires more than intelligence, it requires patience, discipline, and heart. The compassion you develop now will become one of the greatest strengths you bring into every patient interaction throughout your career. The nurse who learns to recognize suffering early becomes the nurse who gives patients a greater chance at healing. As you prepare for the NCLEX and continue your journey through nursing school, it is important to understand that success does not come from memorizing information alone. Azdat Sandiaki Dititi. Success comes from consistency, discipline, critical thinking, and the ability to remain focused even when the process feels difficult. Aksi sen sonsedistis in tischi. Topics like hepatitis B, vaccination protocols, infection control, symptoms, and patient management are not only exam material sekia bedi isei yalas kiki station disease tisin dan ki izat tishan dishin. They are real life situations you will encounter as a nurse responsible for protecting and caring for patients every single day. The NCLEX is designed to test whether you can think safely, prioritize correctly, and respond confidently under pressure. And that is why your mindset matters just as much as your knowledge. Is it gapy? One of the most effective ways to study complex nursing topics is to focus on understanding instead of simple memorization. When you truly understand why hepatitis B spreads, how vaccines work, and why nursing interventions matter, it becomes easier to answer NCLEX-style questions critically. Instead of trying to remember isolated facts, train yourself to think like a nurse. Ask yourself what intervention protects the patient best, what action prevents complications, and what teaching point improves patient outcomes. The NCLEX rewards safe decision making, not guessing. Another important strategy is repetition with purpose. Nursing students often become overwhelmed because they try to study everything at once. But confidence grows when you review information consistently in smaller sections over time. Practice questions are powerful because they help train your brain to recognize patterns and prioritize nursing actions. Every question you answer, whether correct or incorrect, is helping you develop clinical judgment. Do not fear mistakes during practice. Mistakes made while studying are opportunities to improve before entering real clinical situations. Time management is another challenge many students face. Balancing lectures, assignments, clinical rotations, and personal responsibilities can feel exhausting. There may be nights when you feel mentally drained and moments when self-doubt begins to grow. But remember this, FB sartin de se kartin tila padati santi sagyantiya. Every successful nurse has experienced difficult days during their journey. The difference is that they refuse to quit. Discipline matters more than motivation because motivation changes with emotions, while discipline keeps you moving even when you feel tired. Small daily progress creates long-term success. As future nurses, you must also learn to protect your mental strength. I say things someday sunshid. Constant stress and comparison can destroy confidence if you allow it. Some students may learn faster, some may score higher initially, but your journey is your own. Focus on improvement, not perfection. The goal is not to become flawless overnight. The goal is to become stronger, wiser, and more prepared every day. Patients in the future will not need a perfect nurse. They will need a compassionate nurse who remains calm, knowledgeable, and dedicated during difficult moments. When preparing for NCLEX questions related to hepatitis B, remember the major priorities: prevention, vaccination schedules, standard precautions, patient teaching, symptom recognition, liver protection, and safety after exposure to infected blood. All busy. Think carefully about which patient needs immediate attention and which intervention prevents harm first. Nursing always comes back to patient safety and critical thinking. Most importantly, never forget why you started this journey. Nursing is not an easy path, but it is one of the most meaningful professions in the world. Every hour you spend studying today is preparing you to comfort someone in pain, protect someone from harm, and possibly save someone's life tomorrow. Your persistence today is building the nurse your future patients will depend on tomorrow.